So hi, I'm Darnil Pascual from BS Antoy, Nicolamba Doctors College, and I will be discussing about maternal childbirth delivery. So the first question is, what is the difference between cesarean section and normal spontaneous delivery? So let's define it first. So cesarean section usually is a surgical procedure used to deliver a baby through incision of lower part of abdomen and uterine of the mother. In addition, C-section is planned ahead of time if the mother is developing some pregnancy complications. So next one is the normal spontaneous delivery. So that means delivery happens utilizing the vaginal canal of the mother. To be more specific, the baby will withdraw normally through birth canal and into the vaginal passageway together with the placenta after that. So another differences of the C-section and the normal spontaneous delivery is the time frame of procedure and the hospitalization stay of the mother. So in cesarean section, the procedure lasting for 2 hours and the hospitalization stay of the mother is usually 4 to 5 weeks in average. In normal spontaneous delivery, so the procedure is lasting for 12 to 14 hours as usual for the first time mothers. So for the second time mothers is 8 to 10 hours to be average. So in hospitalization stay of the mother with the procedure of NSD, it's lasting for 24 hours to 48 hours to be average. It depends also in the health of the mother. So lastly, this is another differences of CS to normal spontaneous delivery. So in normal spontaneous delivery, the mother may avoid having a major surgery with associated factors such as severe bleeding, scars, infections, and reaction to anesthesia. So because of that, the mother will less woozy after the surgery. So the mother may hold the baby for skin to skin contact, and that's a highly recommended though. And also the mother may begin to breastfeed as sooner to the baby. In cesarean section procedure naman, typically the mother will stay longer in the hospital. So compared to the mother who undergo in the normal spontaneous delivery, so the mother may suffer from blood loss, greater risk of infection in the site, and longer lasting soreness in the site. So the next one is the 3 circumstances that may lead to CS. So the first one is if the mother has medical conditions, so like gestational diabetes. So in gestational diabetes, usually the baby is huge if the mother has gestational diabetes, or what we call in the medical term macrosomia. So in macrosomia, that is huge size of the baby is larger than average weight of the fetus is usually 8 pounds, and it's very hard to deliver very huge size in the birth canal of the mother. That's why it's highly recommended for the cesarean delivery. So this to prevent some injury to the baby during birth. So the second one is the mother may experience some problems in her placenta. So that is one common circumstances that may lead to CS. So like if the mother suffering from, example, placenta previa, we all know that placenta previa is like attached instead of the lower part of uterus, it detached and covering all the cervix. So while covering the cervix, the mother may suffer from severe bleeding, and it's very hard to deliver. The common risk factor of this is if the mother is older, and sometimes the placenta abnormally shaped. The placenta is large and prior to miscarriage. So it's highly recommended also for CS to deliver the baby safely, and also to remove the placenta. The third one, the last circumstances that I know is like the mother has infections like HIV, herpes, active lesions. We all know that in normal spontaneous delivery, the baby will pass through in the birth canal into the vaginal, and if the mother has a vaginal discharge or some infections, it may infect the baby. So that's very it's very threatened. So it's very highly recommended to undergo for a CS to deliver the baby safely without infection of any HIV or any virus that the mother has. So the third one, or the third question, so nursing consideration on each perioperative nursing for CS. So in preoperative preparation, the most and the number one most nursing consideration for this is, so the first thing you need to do is to assess. So because it is the core responsibility as a nurse is to assess. So assess the patient if she has a past surgeries like a CS, if she has a abdominal surgery previously, or she has a medical heart condition that may lead to her current conditions. That's why the reason to undergoing for CS. And also assess for the second illnesses like gestational diabetes, hypertension. If the patient has a suffering for hypothyroidism, always check that and assess that. So you need to check that for knowing all of this and noting this from the patient, you can be better for advocate your patient. So the second one is in the intraoperative preparation doing by the nurse. So the nursing consideration for this is to provide an intubative catheter for the patient. So why? Because we don't want the bladder to be extended. If the bladder has a urine inside, that could be extended and will undergo for the CS. It's possible the bladder it may be cut, or it may be damaged. So that's why we need to empty the bladder to the procedure of the CS is run smoothly. So the last but not the least is nursing consideration for post-operative management. So for me, for my own understanding about the CS procedure, so I will teach the patient to how to perform her self hygiene, or to clean her incision site to prevent some complication or some infections. So that's the most important thing, to educate or to teach the patient properly on how to do that, to do the self-care hygiene, and explain what is the possible risk factor or possible complication infection that happen if they not do the proper thing. So next question, so what is the purpose of episiotomy and episiorrhaphy? So in episiotomy, basically is an incision made on the perineum. So this procedure performed on the second stage labor, on what we call the pushing stage. So The purpose of this procedure is to make the vagina wider for birth. So the purpose of episiorrhaphy is basically the repair of the injury by suturing the incision site made by episiotomy. So next one is the stages of labor. So the first one is the first phase of labor, or also called early or latent labor. So basically this during the latent period, the mother cervix dilates. So sometimes if the cervix are maintained to open or cervix is weak, we put cerclage to help the cervix to be closed. And so in the first stage we have two phases. So this is the active phase and the transitional phase. So in the active phase, so the cervix opens from 4 to 7 centimeters and contraction every 3 to 4 minutes, lasting about 60 seconds. So it often means the cervix is opening faster, about 1 centimeter per hour. So in transitional phase, cervix open from 7 to 10 centimeters. This is the most painful part of the labor. This is when the cervix open to its fullest. So contraction lasts to 60 to 90 seconds and come every 2 to 3 minutes. In the second stage of labor, the baby moves through the birth canal. So basically means the cervix is completely dilated and ends with the birth of the baby. Though the contractions push up the baby down into the birth canal, and the mother may feel like intense pressure. So lastly, in the third stage of labor after birth, the uterus continue to contract. So to push out the placenta usually delivers about 5 to 15 minutes the placenta after baby arrives. Next one is the fourth phase of labor. So we have the passage, the passenger, the power, and the provider. So the first one is the passage. So passage is typically means the structure of the mother's pelvis. So there are 4 types of pelvis. The one is the gynecoid. So this is typical pelvis of the mother, and android, common pelvis of the male, and platycloid is the wide and shallow type, and lastly is anthropoid, which is an wider pelvic but in the vertical aspect, like the head is exact but the shoulders are not. So the passage is typically is based from the fetal position and prenatal presentation. So next is the passenger. So this typically describes the baby, or so like what is the size of the baby, what is the fetal presentation, what is the fetal position. So the power, it says something about the uterine contractions, on how the cervical resistance. So if you have uterine contractions, this shows like the integrity of your muscles. And last one is the provider. Is typically how will the provider well perform any types of delivery, how understand your conditions, or how is her cooperation. So the last question is the 4 T's of postpartum hemorrhage. So the first one is stone. So it is also called the uterine atony. So it's a serious condition that occur after birth. So it occurs when the uterine falls to contract after the delivery of the baby. So it could lead to potentially life it could lead to postpartum hemorrhage. So next one is trauma. So trauma, this is injury to the birth canal, so which includes the uterus, cervix, vagina, and perineum, which happen if the delivery is monitored properly. So next, tissue. This is one of the retained tissue from placenta or fetus. Retained tissue is common cause of one quick way to think is the placenta is formed deeply to uterus and have a accessory lobes, placental tears. So last one is the thrombin. So this is the essentially when there is a failure to blood clot on the mother's end, such as the coagulation disorders, rare cause of postpartum hemorrhage.